Zone Ads, World of Local Business Info. Subscribe to our channel, click the bell icon and select all.
Which is a part of Women's Day celebrations. I'm Niharika, GMT Family Women Specialist. It's my privilege to call the dignitaries on the dais. Firstly, I request today's presiding officer, like GNC leader, to please occupy the rack. I request our GAT member, past district governor, like G. Prahlad Garu, to please occupy the rack. Now I request our chief advisor, past district governor, like Linga Reddy Garu, to please occupy the rack. Really a great privilege of mine to call upon a very special guest, Dr. Chinnababu Suntavali Garu, onto the dais. Please, sir. And also I request the new vice dean to occupy the seats onto the dais. Please, and I request our dynamic leader and chief guest, our district governor and our governor Garu, to please occupy the seat.
Good evening, everybody. We salute our national flag and pledge our allegiance to the same. Its honor and its glory depend upon the zeal and assiduity with which each one of us will shoulder the responsibilities of a good citizen. Its history written in letters of gold inspires us to put in good work for the fair name of our country. We declare our unflinching loyalty to our national flag and maintain that its course shall be our course and that each individual amongst us shall make genuine efforts to add to its luster and glory and make it fly proudly aloft in the comity of nations.
Alliance clubs and especially with District320C, thank you so much for your open-ended offer to work very closely in the future as well, even as we're working in the past. Extremely thankful for that, and this is a commitment from my end that we will work much more closely. We will have much more meaningful awareness sessions across, because today COVID has taught us that distance is not a bar. We can, wherever we are, we can still communicate. So in that sense, certainly we'll be much more happy to drive this awareness campaign across, and also to take these screening campaigns also into rural areas with your support. So that is something that I would really commit from my end, and my greetings and a special mention to the chief guest for today, and of course the past district governors and all the cabinet members seated here. So I would not waste much time, but before I go further, I want to greet all the women seated here. It is your day, and we celebrate your life for the influence you have in society. Now, whenever I talk about Women's Day, I think of my mother, who had a significant influence in my life to make me what I am. She's the one who has fought hard, struggled hard, left all her luxuries, and made us what we are today. So to touch and influence lives and to serve the community. So it is indeed a great effort by the women, and we celebrate what you are. And today I think the whole focus of today's talk would be on women cancer awareness and a little bit on the children, childhood cancer. That's what is the mandate I have been given. So with that, I'll quickly jump into a few presentations, few slides I have, but I would rather want this to be much more interactive, as it's been rightly put in the flyer as well. So more happy to talk and take your feedback, comments, or questions that you may have, and so that it's much more interactive rather than one side. More of a, I don't want it to be too scientific as well, because it doesn't really relate with you. So with that, quickly I will take you through the women cancer awareness session now. So as yeah. So as I mentioned before, I think healthy women are most important for a healthy society. So that's why I think it is necessary for us to really look at the health of the women. The reason I say this with pain is because most of the rural women, especially because of family responsibility and financial issues, and they neglect their health and they come very late. So the outcomes are bad in this part of the world mainly because of late diagnosis. So cancer, in the Western world, the outcomes are much more superior. Cancer is diagnosed in stage 1 and stage 2 in the Western world in 70 to 80% of the times. Whereas 70 to 80% of the times in this part of the world, it is diagnosed in stage 3 and stage 4. So that is the main pain point for us. To lack of awareness is one thing, and then definitely most of the women, at least, they are neglected, and they come, they present very late. So with that, I think there's some issue with my slides. It's not moving. Well-being and not just mere absence of disease. So it is a comprehensive well-being. So what I would like to say is that, cancer in general, probably I would like to use Telugu also in between. That's what I was. So cancer అనేది ఒక జబ్బు కాదు, సుమారు 100కు పైగా క్యాన్సర్ రకాలు ఉన్నాయి. సో క్యాన్సర్ అనగా ఏమిటి అంటే అన్కంట్రోల్డ్, అన్రెగ్యులేటెడ్ డివిజన్ ఆఫ్ ద సెల్స్ ఇన్ ద బాడీ. మన శరీరము కొన్ని కోట్లాది కణాలతో చేయబడింది. శరీరంలో ఏ భాగం ఉన్న కణాలైనా కూడా కంట్రోల్ లేకుండా, అదుపు లేకుండా విభజన చెందినట్లయితే ఒక కంతి ఏర్పడుతుంది. ఆ కంతి ఏర్పడి పెద్దగా అయ్యి వేరే భాగానికి స్ప్రెడ్ అవుతూ ఉంటుంది. సో దాన్ని మనం క్యాన్సర్ అంటాం. సో ఎన్ని రకాల క్యాన్సర్ ఉన్నాయి? సుమారు 100కు పైగా క్యాన్సర్ రకాలు ఉన్నాయి. శరీరంలో ఏ భాగం క్యాన్సర్ రావచ్చు అన్నట్లయితే, శరీరంలో ఏ భాగం అయినా కూడా క్యాన్సర్ రావచ్చు, ఎక్సెప్ట్ మన తల వెంట్రుకలు, గోల్డ్ తప్ప మిగతా ఏ భాగమైనా కూడా రావచ్చు. సో ద మోస్ట్ కామన్ గా వచ్చేటువంటి క్యాన్సర్ సైట్స్ గురించి కూడా నేను చెప్తాను. ఆడవారిలో ముఖ్యంగా క్యాన్సర్ కనబడేటువంటిది ఎక్కువగా ఏంటంటే, మన దేశంలో కానీ వరల్డ్ వైడ్ గా మనం చూసినట్లయితే రొమ్ము క్యాన్సర్ నంబర్ 1, నంబర్ 2 అనేటువంటిది సర్వైకల్ క్యాన్సర్, అంటే గర్భాశయం ముఖద్వారపు క్యాన్సర్. థర్డ్ ఓరల్ క్యాన్సర్స్, again అందరికీ తెలుసు, టొబాకో చూయింగ్ కావచ్చు, పొగాకు నమ్మటం కానీ, పొగ సేవించడం, త్రాగటం కానీ, దానివల్ల వచ్చేటువంటి. సో కాబట్టి ఈ 3 ఆడవాళ్ళలో ముఖ్యంగా కనబడే క్యాన్సర్స్. పురుషుల్లో మన దేశంలో అతి ఎక్కువ కనబడే క్యాన్సర్ ఏంటి అంటే నోటి క్యాన్సర్, ఓరల్ క్యాన్సర్స్, తర్వాత లంగ్ క్యాన్సర్, తర్వాత యూ విల్ హ్యావ్ కోలాన్ క్యాన్సర్ అండ్ గ్యాస్ట్రిక్ క్యాన్సర్ అన్నమాట. సో దెన్ కమ్స్ ద ప్రోస్టేట్ క్యాన్సర్. సో క్యాన్సర్ అనగా ఎక్కడైనా శరీరం ఏ భాగంలో కూడా ఇది ప్రారంభమవచ్చు. కొన్ని బ్లడ్ క్యాన్సర్స్ అంటారు, రక్త కణాల్లో అయిన దాన్ని బ్లడ్ క్యాన్సర్ అంటాం. సో రొమ్ములో ప్రారంభమైతే, రొమ్ము కణాల్లో ప్రారంభమైతే రొమ్ము క్యాన్సర్ అంటాం. సో కాబట్టి ఈ యొక్క ప్రపంచవ్యాప్తంగా క్యాన్సర్ యొక్క ఇంపాక్ట్ ఏంటి మనం చూసినట్లయితే, if you look at the impact of cancer globally, it's the second leading cause of death after cardiac cause of death. Cancer is the number 2 cause for death. 1 out of every 6 people, the cause of death is cancer. So in that sense, it is a very significant. దీని గురించి మనం ఈరోజు ఇంత టైం స్పెండ్ చేయడం అనేది it is meaningful. You can take this message across. మీరు ఈ వర్తమానాన్ని 100 మందికో 10 మందికో 20 మందికో చెప్పినట్లయితే ఖచ్చితంగా మనం వారికి మేలు చేసిన వాళ్ళు అవుతాం. సో మనం ఇక్కడ చూసినట్లయితే 1 out of every 6 lives, it is, మీరు కోవిడ్ గురించి మీరు చూసినట్లయితే లాస్ట్ 2 years లో the total number of deaths because of COVID, how much అండి? అందాజుగా 5 lakhs ఓవరాల్ గ్లోబలీ. But one thing I can tell you, cancer deaths annually, how much am I చూసినట్లయితే, if you look here, cancer account deaths in only 2018, they said 10 million deaths, which is a huge number, and it's a silent killer. It won't be seen very easily anamata. So in that sense, it is very significant. కాబట్టి మనం దీని గురించి ఆలోచించవలసిన అవసరం ఎంతైనా ఉంది. So as I said before, breast cancer is the most commonly diagnosed cancer in women, and it is also the leading cause of cancer death in women. Then of course, as I mentioned, cervical cancer overall కింద ఉన్నప్పటికీ ఇండియాలో it's number 2 still. Of course, it was the number 1 cancer. Health and hygiene improve అవటం వల్ల, లైఫ్ స్టైల్ ఇంప్రూవ్ అవటం వల్ల cervical cancer యొక్క సంఖ్య అనేది కొంచెం వరకు తగ్గింది. But definitely we still have, it has a significant problem. ఎందుకు cervical cancer గురించి చెప్తానంటే, this is one cancer which can be prevented. It's totally preventable, but it is not prevented. దీన్ని నివారించగలము కానీ మనం నివారించలేదు. ఎందుకంటే 99.9% ఎఫెక్టివ్ వ్యాక్సిన్ దీనికి అందుబాటులో ఉంది, కానీ there is no awareness for it. Forget about the rural community, even in the urban community there is no awareness and people do not go for this vaccination. So that is something that you can take as a very significant message, that a preventable cancer is not prevented. purely because of lack of awareness and lack of the knowledge. So we'll quickly look at what we can think of for breast cancer. As I said before, breast cancer again starts within the tissue or the cells of the breast. And can breast cancer occur in men? Yes, it can still occur in men as well. But it's very rare. 1% of the breast cancers are seen in men, 99% in women. Okay, so the treatment is same for both men and women. So as I said, why are we worried? It's because the most common cancer in women in the world. If you look at globally, this is the most common. Globally, they say 1 in 8 women will get breast cancer, which is a huge number. But 1 in 8 in their lifetime, I'm talking about, right? So in an Indian context, it's 1 in 24 or 32 based on different studies. But still, for our population, it's a very big number. So if you see globally again, I don't want to go into the details, but definitely it is a significant problem in Asia at least, more than the Western world. I think in Asia and Europe, we have the highest numbers, right? So as I said, for the Indian context, 1 in 28 is mentioned here. So, sadly, every 2 minutes you see a woman is diagnosed with breast cancer. Every 2 minutes, even as we are seated here, many people are diagnosed with breast cancer. But the 2 నిమిషాలకి ఒక స్త్రీ రొమ్ము క్యాన్సర్ డయాగ్నోస్ అవుతా ఉంది. So కాబట్టి of late the best part is the outcomes of breast cancer treatment are extraordinary. Today we talk about breast cancer patients even in stage 3, stage 4, living for at least 10 years or 10 plus years also in some conditions. Again, every the cancer depends upon the biology of the disease. Not everybody will behave the same. కొంతమందికి stage 1 లో ఉన్న వాళ్ళు కూడా తెలియని వాళ్ళు ఉంటారు. But ultimately the outcomes depend upon the stage. So earlier the stage, more the chance of cure. That's the reason we need to focus on not only awareness but also for early detection. So this is one disease where early detection is possible. So what causes breast cancer? If you have to understand as a woman, we need to know రొమ్ము క్యాన్సర్ దేని వల్ల వస్తుంది, what are the risk factors? So there are 2 types of risk factors. ఒకటి modifiable risk factors, the other one is non-modifiable risk factors. అంటే మనం మార్పు చేయలేనటువంటి కొన్ని రిస్క్ ఫ్యాక్టర్స్ ఉన్నాయి. అవి ఏంటి అంటే ఏజ్, వయసు పెరిగే కొద్దీ రొమ్ము క్యాన్సర్ వచ్చే రిస్క్ అనేది పెరుగుద్ది. రెండవదిగా జెండర్, అంటే ఆడవాళ్ళలో 99% ఇది ఉంటుంది. మెన్ హ్యావ్ ఓన్లీ 1% ఛాన్స్ ఆఫ్ హ్యావింగ్ బ్రెస్ట్ క్యాన్సర్. థర్డ్లీ జెనెటిక్ ఫ్యాక్టర్స్, అంటే జన్యుపరంగా కూడా వచ్చే అవకాశం ఒక 10 నుంచి 20% ఉంటుంది. ఫోర్త్ వన్ ఇస్ ఫ్యామిలీ హిస్టరీ, అంటే కుటుంబంలో ఫస్ట్ డిగ్రీ రిలేటివ్స్, అంటే చాలా దగ్గర సంబంధం, ఫస్ట్ డిగ్రీ రిలేటివ్స్ అంటే ఇప్పుడు తల్లి కావచ్చు, అక్క కావచ్చు, లేక మీ కుమార్తె కావచ్చు. దిస్ ఇస్ కాల్డ్ ఫస్ట్ డిగ్రీ రిలేటివ్స్, మదర్, సిస్టర్ ఆర్ డాటర్. ఓకే, సో వీళ్ళలో రొమ్ము క్యాన్సర్ వచ్చినట్లయితే more than 2 members in the family have breast cancer in early age అంటే less than 50 లో వచ్చినట్లయితే it is called a significant family history. సో వాళ్ళు జెనెటిక్ టెస్టింగ్ చేయించుకోవడం చాలా మంచిది. సో ఫ్యామిలీ హిస్టరీ is also very important, which is non-modified. దీన్ని మనం ఎవరు మార్చలేము. వీకాన్ ఎంత అవేర్నెస్ ఉన్నా కానీ దీని గురించి టెస్టులు చేయించుకోవచ్చు కానీ వీటిని మనం మార్చలేము. బట్ వాట్ కెన్ బి మోడిఫైడ్? ఇఫ్ యు లుక్ అట్ దీస్ ఆర్ ది మోడిఫైబుల్ రిస్క్ ఫ్యాక్టర్స్. వీటన్నిటిని కూడా కొంత వరకు మనం మార్చవచ్చు విత్ అవేర్నెస్, విత్ ఎడ్యుకేషన్, బిహేవియరల్ చేంజ్, లైఫ్ స్టైల్ మోడిఫికేషన్. వీ క్యాన్ డెఫినెట్లీ బీట్ దిస్ డిసీజ్. Look at obesity is a big risk factor for breast cancer. Hormonal imbalance వల్ల రొమ్ము క్యాన్సర్ రిస్క్ ఎక్కువగా ఉంటుంది. ఒబేసిటీలో ఎక్కువగా హార్మోన్ యొక్క ప్రొడక్షన్ అవుతూ ఉంటుంది. సో ఇఫ్ యు లుక్ అట్ ప్రెగ్నెన్సీ ఇస్ a protective for breast cancer. ఈ రోజుల్లో ప్రెగ్నెన్సీని అవాయిడ్ చేస్తూ ఉన్నారు, డిలే చేస్తూ ఉన్నారు. చైల్డ్ బేరింగ్ అనేది చాలా డిలే చేస్తారు. ఇదివరకు అర్లీ మ్యారేజ్, అర్లీ చిల్డ్రన్ అయితే ఉండేది. సో ఇప్పుడు pregnancies because of the absence of the hormonal effect for those 9 months left, because there is no production of these hormones, so there is protection from pregnancy. So similarly, lactation, breastfeeding was beneficial to prevent breast cancer. These days it is the fashion not to have children or to delay children. So in that sense our lifestyle is changing, that is causing more risk of the breast cancer. Excessive consumption of alcohol, especially in this part of the world, we can see even the women, the present era, if you look at the entire generation, right, it has become much more more than smoking. Now alcohol has taken precedence. The number of pubs you see in the main streets of Hyderabad, you would make out how the trend is moving towards. So it is definitely a risk factor which can be modified, provided we all can come together. So exercising regularly, maintaining ideal body weight, quitting smoking, avoiding excessive alcohol consumption, breastfeeding, all these can help to reduce the risk of breast cancer. So how can we detect it early? So this is modifiable risk factors. If you're obese, or you can have physical activity, all that we do, the cancer run and all to promote healthy lifestyle. So how can breast cancer be detected early? If somebody is having, how can they present very early? Can it be detected very early? ముందశలో రొమ్ము క్యాన్సర్ ఎలాగో కనుగొనవు అంటే 3 రకాల టెస్టులు అందుబాటులో ఉన్నాయి. ఒకటి రొమ్ము స్వీయ పరీక్ష, breast self examination, which can be done from the age of 30 years. 30 సంవత్సరాల పైబడిన స్త్రీ ప్రతి వాళ్ళు కూడా నెలకు ఒకసారి రొమ్ము స్వీయ పరీక్ష చేసుకోవాలి. నెలకు ఒకసారి ఎప్పుడు చేసుకోవాలి? 7 days or 1 week after the menses have stopped. So appudu the breast will be more supple, they will be able to make out any changes or any new lump or any abnormality in their breast. So that is number one. Rhombosvia pariksha, anybody can do, even the rural women can be trained to do self-examination. There is a systematic step-wise how to do, videos are available, literature is available, all that can be shared. That is number one. Number two, clinical examination by a doctor or even a trained nurse once in a year after 40 or once in 3 years from age of 30 to 40. Thirdly, most important screening test available for breast cancer early detection is mammography. Mammography is nothing but an X-ray of the breast. It is just an X-ray of the breast which can pick up a lesion which is just half a centimeter, which you cannot feel with your hand, but it can be picked up with this X-ray. So who has to take a mammography? It is not suitable for younger women. It is for women above 40 years. In Indian context, we can keep 35 as a cutoff. Because usually if you have a dense breast, it cannot pick up or show the changes in the breast. That's the reason it's not advised for younger women. So above 35, mammography can be advised. It can be done, at least once every 2 years, if not annually. In the Western world, it is a part of the routine health checkup annually to undergo the mammography. So as I said before, breast self-examination once every month. What to look for in the breast self-examination? Size, shape, or the color, any new lump, any abnormality in the breast in terms of dimpling or the puckering or the change in the nipple inversion or push inside, redness, any change. You don't have to remember all this. Anything which is not normal. ఇది వరకు ఉన్న దానికంటే ఇప్పుడు కొత్తగా మార్పు ఏమైనా కనబడిందా, అదొక మాట గుర్తుపెట్టుకుంటే చాలు. ఇవన్నీ తెలుసుకోగలరు ఎలా ఉంటుంది ఏంటని. ఏదైనా కొత్తది ఎలాంటి మార్పు ఉన్నా కూడా దాన్ని మనం వెంటనే నిర్లక్ష్యం చేయకుండా డాక్టర్ చూపించుకోవాలని మనం చేస్తుంటున్నాం. సో breast self examination, I think as I mentioned before, it's available, all the material is available, we can share. సో ఒకవేళ రొమ్ము స్వీయ పరీక్ష చేసుకుంటే ఏదైనా కణితి కనబడితే ఏం చేయాలి? కంగారు పడాల్సిన అవసరం లేదు. వెంటనే మీ డాక్టర్ దగ్గరికి వెళ్ళండి, పరీక్ష చేయించుకోండి. సో రొమ్ము క్యాన్సర్ స్క్రీనింగ్ ఎందుకు చేయాలి అని చెప్పినట్లయితే, సర్వసాధారణంగా కనబడే క్యాన్సర్ ఇది కాబట్టి దీని గురించి మనం ముందుగా కనుగొంటే మంచి ట్రీట్మెంట్ అందుబాటులో ఉంది, పూర్తిగా నయం చేయవచ్చు. సో early detection helps in complete cure of the disease. I'm again re-emphasizing on that. So breast cancer screening, especially for women between 40 to 44, the American Cancer Society recommendations, the annual breast cancer screening programs that they have to take up. So about 55 they can do once every 2 years, not necessarily that every year they have to undergo. Okay, so as I said before, mammography, this is the mammography. You see that yellow mark there, that's where the lump is. The whitish color thing, that is abnormality, very small one. Even if you don't feel, it can be picked up with the X-ray. So what are the signs and symptoms of breast cancer? Most common presentation of breast cancer is any lump in the breast. రొమ్ములో కొత్తగా కంతి ఏర్పడినట్లయితే నిర్లక్ష్యం చేయవద్దు. Especially the younger women, 20 to 30s lactating women, there will be small lumps which are called traditionally as milk lumps, పాలగడ్డలు అంటారు. So they are all called fibroadenomas which are not malignant, which will not lead to cancer. Out of every 10 lumps, 7 to 8 are benign. మామూలు గడ్డలే, 10 గడ్డలు 8 గడ్డలు మామూలు గడ్డలే. So every lump is not cancer. But for women above 40, if there is a new lump, it should not be ignored. Younger women, పిల్లలు 20-25 ఆ ఏజ్ లో ఉన్న వాళ్ళు కూడా క్యాన్సర్ రాదని లేదు. I have done a surgery for a girl who was 16 years old. So it is not that younger people, but it is not common. As the age increases, the risk increases. That's what we saw in the non-modifiable risk factors. So as I mentioned before, please note for any change in the breast or the nipple appearance or dimpling, retraction of the nipple or the bloody discharge from the nipple or any swelling in the armpit or any unusual symptom. right? Weight loss, not able to eat, right? You have a back pain which is persisting for more than 2 weeks, then it has to be reported to the doctor. So if you have a lump in the breast, what to do? Younger women do an ultrasound, and as I said before, more than 35 actually, here is mentioned 30, so mammography has to be done. So then the best way of knowing whether it is cancerous or not is by doing a biopsy. So it's a needle test. ఒక చిన్న సూది పరీక్ష చేసి ఇది క్యాన్సరస్ కాదా అని తెలుసుకోవడానికి వీలుపడుతుంది. So breast cancer again treatment we don't have to worry because the results are extremely good. We used to do traditionally total mastectomy. ఇది వరకు రొమ్ము క్యాన్సర్ అంటే మొత్తం రొమ్ము తీసేవాళ్ళు. ఇప్పుడు now we are doing a breast conserving surgery. In the good old days, we used to remove all the lymph glands in the armpit, which used to cause lot of disability, arm swelling రావడం కానీ, shoulder pain రావడం కానీ, so lot of morbidity was there. But today we are looking at avoiding all this morbid surgeries, but yet at the same time cure the disease. అంటే తక్కువ ఆపరేషన్ తోనే మంచి రిజల్ట్స్ వచ్చేటువంటి టెక్నాలజీ అయితే ఇప్పుడు అందుబాటులో వచ్చింది. October is breast cancer awareness month, and that's why we from Breast Cancer Foundation do organize the cancer run in the month of October. The second Sunday is the fixed Sunday. This year is going to be the 5th edition of the same. So it's only because of such an importance for the breast cancer, because most common cancer globally. Right, the second most common cancer is gynecological cancers in women, the cervical cancer as I mentioned before. So and then the uterine cancer. So cervix is nothing but it is the mouth of the uterus, garbhashayapu mukhadwaramu, and this is again as I mentioned before, it comes because of an infection with a virus called human papilloma virus. HPV అనేటువంటి ఒక వైరస్ నుంచి ఈ యొక్క క్యాన్సర్ వస్తుంది. So there are various types of human papilloma virus. 16 and 18 అనేటువంటిది 70% of the times it causes this disease. So again, cervical cancer also can be completely cured if it is diagnosed very early. So how can we control cervical cancer? Cervical cancer రాకుండా ఉండాలంటే మనం ఏం చేయగలం? Number 1, primary prevention. ప్రాథమికంగా దాన్ని నిరోధించాలి అంటే vaccination against HPV. I think we all must come together and take up HPV vaccination drives in a big way. The way we have taken COVID vaccination drive. There is so much importance, necessity for taking this vaccination drive. HPV vaccination అనేటువంటి ద్వారా పూర్తిగా ఈ జబ్బు భవిష్యత్తులో రాకుండా ఉండడానికి ఆస్కారం ఉంది. There is one cancer, yes sir.
How much does it cost, that vaccination, and how many times and interval?
There are various companies have produced something called Gardasil, which is for 2 doses, 0 and 6 months, and then there is a 9-valent or a quadrivalent. It all depends on how many viruses is active against basically. So 9 viruses is 9-valent. So that is the one which is produced by Merck, which costs about close to 2,000 rupees per dose. But again, it's all volume game, wherein if you have more numbers, we can always have some kind of a negotiation with the company and get it at a much lesser price. So this is something that we all I think must commit today. That we would in our own areas of influence we would propagate, we would get it done. Today I have taken a call that I will get my daughter vaccinated, right? So that's how we need to kind of set an example and motivate others also to vaccinate. Usually the vaccination is done from the age of 9 to 13 years you can start, and before 18. So before they are married and before they are sexually active, that's when it has to, because the infection it's a sexually transmitted infection. It's very common. HPV infection ever ఉంటుంది అంటే 90% women have this infection. ఇదేదో కొత్తగా వచ్చే వింటర్ ఇన్ఫెక్షన్ is there everywhere. So కాబట్టి it's not a rare infection. మాకేమో ఇన్ఫెక్షన్ లేదులే అవసరం లేదు అలాంటి పరిస్థితి పడదు ఇక్కడ. It is commonly seen viral infection. So that's why primary prevention is with the vaccination. Secondary prevention is possible through screening and treatment very early by catching the pre-cancerous lesions. Cervical cancer, early cancer changes in the cancer avalante minimum 5 to 10 years పడుతుంది. So that's a window of opportunity for us to detect it very early. Pre-cancer, cervical intraepithelial, you don't have to know about it. It's a pre-cancerous lesion. Cancer ముందు స్టేజ్ లో ఉన్న కండిషన్ నుంచి క్యాన్సర్ అవ్వాలంటే 5 నుంచి 10 సంవత్సరాలు పడుతుంది. So ఈ టైంలో మనం స్క్రీనింగ్ టెస్ట్ చేస్తే, ఫర్ ఎగ్జాంపుల్ ప్యాప్ స్మియర్, దట్స్ వాట్ వి డు త్రూ అవర్ మొబైల్ స్క్రీనింగ్ క్యాంపెయిన్, దాని ద్వారా ముందస్తులోనే మనం దీన్ని కనుగొనడానికి వీలు ఉంది. So there is a wonderful opportunity to detect it very early and completely cure. Tertiary prevention is basically once somebody has a symptom, బ్లీడింగ్ పర్ వైద్యం కావచ్చు, లేకుంటే వైట్ డిశ్చార్జ్ ఎక్సెస్గా అవుతూ ఉండొచ్చు. ఇలాంటి వాళ్ళు వెంటనే వాళ్ళు చూపించుకుంటే వాళ్ళు డయాగ్నోస్ చేసి అర్లీ స్టేజ్లోనే మనం దాన్ని నయం చేసే ఆవిష్కారం ఉంటుంది. సో దేర్ ఆర్ 3 levels of prevention or the control of cervical cancer. So vaccines గురించి ఆల్రెడీ నేను చెప్పాను, so I don't want to repeat it again. So from 9 to 14 years of age, this is the vaccine that we recommend, HPV vaccine. So is it safe? Yes, it is definitely safe. It has been tested in millions of people, and it is not a new thing. We were all very scared with COVID vaccine as well initially, but definitely people who are vaccinated had a much better outcomes for sure. So given that, I think there is a cancer can be prevented with the vaccine is a big news actually. But unfortunately, it is totally, again, there are different issues. If a small mishap happens somewhere for something which we do not know, there is sensationalizing, and the way media works also. That's why HPV vaccination has gone back to a vaccine because of that. Somewhere in Khammam or Karimnagar there was a vaccination and some child had some issue which was attributed because of the vaccine, and the whole program went to the negative side. So I think that's where we need to, as a kind of influence in society, we need to come forward and give that assurance to society and make them participate in this. So that's what is about cervical cancer. So we talked about breast cancer, we talked about cervical cancer. Uterine cancer is third most common gynec cancer we can say. So that is again pretty. But I did before about the uterine cancer, the cervical cancer screening. As I said before, there are simple tests like pap smear, which can be done once every 3 years. Above 21 years, it can be done once every 3 years. For those who have undergone hysterectomy, there is no need to repeat it every 3 years. It need not be done for them because the cervix is already removed. So for them, the risk is very, very minimal. They need not undergo testing. Right. So the third one is the uterine cancer. Again, it is because of obesity, age above 50 years. People who are on replacement therapy with the hormones have more chances. These days, uterine cancer is very commonly seen. In fact, today I did 2 surgeries for robotic surgery for uterine cancer actually. So it is pretty common. It's more common than cervical cancer in the urban population. Rural areas still cervical is there, but in urban, because of lifestyle again, hormonal imbalance, obesity, the food that we eat, the air that we breathe, and the water that we drink. I think everywhere there is so much of pollution, and it is the main reason for the increased number of cases. So again, how to prevent uterine cancer? Keeping a healthy weight, being physically active can reduce the risk of getting uterine cancer. So that's what we can. What are the symptoms of uterine cancer? Again, we don't have a definitive method to screen the uterine cancer, but again, any women after the menopause having spotting or bleeding, unless otherwise proved, it is because of uterine cancer. It is so important. After menopause, if there is any spotting or any bleeding, unless otherwise proved, we have to rule out that it is not uterine cancer. So the symptom is so important. So we cannot neglect the symptom. So this is something that we can convey to our friends and well-wishers. So
Doctor, I have a question.
please.
Like after menopause, is there a time gap that we looking for this? Like when you say that a lady has not been bleeding for some time.
Right.
So is there a time gap that we looking to probably after a year or after?
Yeah, usually 12 months is the time that we see, and after 12 months, if there is spotting, it is significant. So sometimes there could be irregular bleeding, and it is like they are perimenopausal, they are in the borderline wherein there could be delays. So we are not looking at that. Once it's completely stopped for more than a year, and then you have a spotting, that should not be ignored. Yeah. So, well, apart from that, I think I would just leave you with the 7 cancer warning signs that we can take home as a message today. The most important of them is C stands for change in bladder and bowel habits. మలమూత్ర విసర్జనలో మార్పులు కొత్తగా వచ్చినాయి. ఇటీవల ఎక్కువగా కాన్స్టిపేషన్ అవుతుంది, మోషన్ అవటం లేదు, మోషన్లో రక్తం వెళ్తుంది, యూరిన్ రక్తం వెళ్తుంది, లేక ఎక్కువ విరోచన అవుతుంది, చీమ్ వెళ్తుంది. Any changes in your bowel and bladder habits which are persisting for more than 2 weeks. ఒకసారి విరోచనం రావడం, ఒకసారి కాన్స్టిపేషన్ ఫుడ్ బట్టి అందరికీ వస్తుంటాయి. So you don't have to panic for that. If you have this persisting for more than 15 days, you have blood in the stool, it cannot be ignored, right? So that is C stands caution. C stands for change in the bowel and bladder habits. A stands for a sore which does not heal. అంటే మానని పుండు, శరీరంలో ఏ భాగమైనా కూడా ఒక పుండు ఏర్పడింది, అది మానటం లేదు అంటే ఇట్ ఇస్ అ సైన్ ఆఫ్ క్యాన్సర్. ఫర్ ఎగ్జాంపుల్ టంగ్ బైట్ అయింది, నాలుగు ఖర్చుకున్నాం, పుండు అయింది, ఒక వారంలో 10 రోజులు మానిపోతుంది. మానకుండా ఉంది, నొప్పి లేదు అంటే కూడా ఇట్ ఇస్ క్యాన్సర్ సైన్. సో a sore which does not heal is a sign of cancer. U stands for unusual bleeding or discharge. అంటే అసాధారణమైనటువంటి రక్తస్రావం కానీ లేకుంటే డిశ్చార్జ్ అవటం కానీ ఉన్నట్లయితే ఇట్ షుడ్ నాట్ బి ఇగ్నోర్డ్, ఇట్ వుడ్ బి ఎ సైన్ ఆఫ్ క్యాన్సర్. T stands for thickening or lumps anywhere in the body which have recently appeared. పుట్టిన చిన్నప్పటి నుంచి చిన్న చిన్న కంతులు చాలా మందికి ఉంటాయి, వాటి గురించి కంగారు పడక్కర్లా. రీసెంట్ గా ఏదైనా కంతి ఏర్పడి అది పెరుగుతూ ఉంది, నొప్పి లేదు అన్నా కూడా ఇట్ ఈస్ సంథింగ్ దట్ యూ షుడ్ నాట్ ఇగ్నోర్. ఎనీ లంప్ ఇన్ ద బాడీ which has recently appeared, painless but increasing in size, do not ignore. I stands for indigestion or difficulty in swallowing. మింగడానికి ఇబ్బందిగా ఉంది, నీళ్లు తాగకపోతే నేను మింగలేకపోతున్నాను అంటే it could be a sign of a cancer in the food pipe. So indigestion or difficulty in swallowing, again I'm not talking about one episode then everybody has to get testing done every other day. It is not possible, it is not necessary. O stands for an obvious change in the wart or the mole, birth mole. పుట్టు మచ్చల్లో ఇటీవల మార్పు వచ్చి దురద వస్తుంది, బ్లీడింగ్ అవుతుంది, సైజ్ పెరిగింది అంటే ఇట్ కుడ్ బి సైన్ ఆఫ్ స్కిన్ క్యాన్సర్. చాలా మంది పుట్టు మచ్చలు ఉంటాయి కానీ పెరుగుతూ ఉంది, దురద వస్తుంది, బ్లీడింగ్ అవుతుంది అంటే ఇట్ ఇస్ ద సైన్ ఆఫ్ క్యాన్సర్. N stands for nagging cough or hoarseness. అంటే గొంతుకు బొగురు పోవడం. సో హోర్స్నెస్, జలుబు చేస్తే ఒక వారం 10 రోజులు మనకి వాయిస్ చేంజ్ ఉంటుంది, బట్ మోర్ దెన్ 2 weeks వాయిస్ చేంజ్ అయ్యింది, మన మాటలో తేడా అనిపిస్తుంది, పక్కన వాళ్ళు చెప్తున్నారు అంటే దట్ విల్ బి సైన్ ఆఫ్ లంగ్ క్యాన్సర్ ఆర్ థ్రోట్ క్యాన్సర్. సో దీస్ సిమ్టమ్స్ షుడ్ నాట్ బి అంటే దీస్ సిమ్టమ్స్ దగ్గర మన సైన్స్ ఎందుకు వచ్చామంటే దిస్ ఇస్ ఓన్లీ ఫర్ detecting it little bit early so that we don't postpone your visit to a doctor and then diagnose very late where nothing much can be done. So these are the common signs of cancer. So prevention, I think I don't have to tell much. It's all mentioned there. The picture speaks volumes, right? I think the physical activity, your diet, the balanced diet wherein you have a regulation of your carbohydrates versus your protein versus your fat, and definitely I think consumption of alcohol, your habits with tobacco, all that makes sense. So more important, I think to prevent. Most importantly, in general, to prevent cancer, I think screening for early diagnosis is very important, and vaccines for 2 cancers. One I said for cervical cancer. There is another vaccine called HBV vaccine, hepatitis B virus vaccine for liver cancer. So these 2 cancers are available. 2 vaccines are available for prevention of cancer. So we can take this message across. So as I said, I think we need to together beat cancer, and let's all strive towards eradicating cancer. At least cervical cancer can be eradicated in the next 20 years, provided we all pledge to take this HPV vaccination to the next level. So late diagnosis is a big issue. That's the reason we have very, very poor outcomes, and it's very pathetic. Even children detected with childhood cancer as well are diagnosed very late. And the reason is delay by parents. Why childhood cancer? I'm just going towards a little bit of childhood cancer as well. So delay by parents in seeking the medical advice. Delay by doctors also, because pediatricians many times they won't even suspect the symptoms that the child is having. So not only advice, even getting a test done. Delay in reaching an oncologist is difficult. Delay even in starting treatment because a lot of battery of tests to be done for pediatric cancers, and that's why this leads to poor outcomes. So the common cancers in children based on the age is mentioned there. 0 to 4 years, we see the blood cancer called leukemias, and then you have the eye cancers called retinoblastomas, the neuroblastoma, the tumor of the kidney called the Wilms tumor, liver tumor called hepatoblastoma, and then we have few others. So you don't have to really get into all these subtypes because in general pediatric cancers are not that common. But again, if you look at children, it is a significant cause of death as well. So it is not something that can be ignored. So we need to be a little bit aware. If you look at adult cancers versus pediatric cancers, how does it differ? Adult cancers are relatively common, pediatric cancers are very rare, right? So carcinomas, the most common, they come from some of the common cells in the body, but pediatric cancers, they come from the embryonic cells. Because of some embryonic cell rush which are there in the body, that leads to cancers in them. And of course, most of the times pediatric cancer, the best part is they're chemosensitive and they respond very well and they get cured also in majority of the times. So in adult cancers again, early stage surgically curable, But again, pediatric cancer, even in early stage, since it's a systemic disease, many times pediatric cancer they require chemotherapy, but they respond very well. So in that way, there is a difference between the adult and the pediatric cancers. So as the age increases, the adult cancer is also increases, but again, pediatrics we don't see that pattern. So what are the symptoms or the signs of childhood cancer? Probably simplest thing will be again unexplained weight loss. Child is not able to kind of bear the increase in the weight, headaches. Most commonly early morning vomiting is a sign, and then increased swelling or the pain in the bones or the joints. Any lump or the mass anywhere in the body, and for blood cancers, excessive bruising or rash or bleeding after brushing. Right, so that could be a sign wherein your platelets are not working well. That's the reason there is bleeding. So apart from that, constant regular, too many times there is infections. So your immunity has come down. There is that is also again a risk factor or a sign for childhood cancer. And of course, people for retinoblastomas, a whitish color behind the pupil, or nausea, vomiting, which is or a seizure or some kind of a convulsion, could be also a sign of childhood cancer. And of course, loss of constant tiredness, not able to grow, and more paleness, hemoglobin is very less. That would be again a sign. So vision changes also can be a sign of childhood cancer. So I won't be dwelling too much into these things. Just the difficulty in childhood cancer management or the diagnosis, because the manifestation is very vague. Unlike in adults, you don't have a specific symptom that the child can really appreciate and tell to the mother. So that's the reason vague manifestations so very difficult, and of course in general also child cancers are rare. So it is a good news in that sense. So even the doctors also reluctant to consider cancer as one of the differential diagnoses when the child keeps on going to them. So because of that, we find it difficult to diagnose this thing. So I think the problem is a vicious cycle. I think this is what we need to, as an influence in society, look at this. We have limited resources, especially in the rural areas. We have a low capacity. We don't have an oncologist available in district places, right? So poor access. So many patients present with advanced disease and many potential patients are more than. So there is a high mortality rate. So there is a unmet need for terminal care, even for those with stage 4. We don't even give them dignified exit from this world. So in that sense, for palliation also there is a big need. So this is what is the problem, a vicious cycle that we find. So what can be done? The solution is to build the capacity. Probably I think we need to have a greater capacity, improved access, so that you focus on prevention. So that's where I think through education and screening we can reduce the burden of this disease. So that's where the mortality rates can be much more lesser, and that's how we can beat cancer. And I request each one of you to pose your comments or thoughts or any questions that you may have, so that it's really interactive. Thank you so much for your hearing.
Yes, Doctor, alcohol and cancer. Alcohol and cancer.
Yes.
How do we
How do you correlate? Yeah. See, alcohol is a risk factor because alcohol is an irritant. Any chronic irritation, of the cells will lead it to multiply faster. So make the oral cavity or the throat, or stomach, bladder cancer, kidney cancer, even pancreas. So at least 7 to 8 of them are proven to be linked to alcohol. And again, it is the various studies have shown excessive consumption. Again, what is excessive, what is normal for somebody, may not be normal for others. So there are various definitions. So I don't want to get in there.
relative term.
It's a relative thing. Yes, sir.
Sir, for a young mother who has had this breast cancer and she is expired, the children specifically, of course, the daughter has to take the preventive steps, but the son, like you were telling about the genetic tests that are
Correct.
should the son undergo such sort of tests as well?
Sure, I think this is a very important question and the thought that is raised, because for young women, if they have breast cancer, most commonly it is because of something called as a BRCA gene mutation, BRCA gene mutation. I think you all must have heard about Angelina Jolie. She underwent a prophylactic surgery for breast removal, and for even her ovaries and fallopian tubes were removed because her mother had and her aunt had ovarian cancer and they were BRCA positive. So to come back to the specific question that you posed, most important is to know that mother is BRCA positive. If the genetic positivity is there in the mother, then the family will be tested. If she is negative, there is no point in it. Not every cancer is because of the inherited genes. The BRCA genes, what we are talking about is 80 to 90% cancers are because of sporadic genetic mutations. They are not carried forward. So only 10 to 15% is only hereditary. So given that, we need to test on the first patient first in their sample, at least if not blood sample is not available, the tumor tissue we can test, and then it can be tested for the germline mutation in the family then. So even males also can be tested because it's not that because they need to look at their family in the future as well. So given that, I think if the parents see again genetic testing is not that easy. You can't just go to the lab and get a genetic testing done because lot of so many factors come into the picture here. Psychological trauma if it's positive. Social stigma. What happens in the insurance sector? How for their marriage, for their relationship, so many things are there. So it is very complex issue that we cannot. But again, in a close circle, family will be counseled well by genetic counselor, and then the test has to be taken.
Doctor, my question is actually continuing like with what he has asked just now. I know a specific case in US, like where the father has passed away with colon cancer at the age of 40. Like he has two daughters. One is around 15, 16 years old and the other one is around 7 years old. Like, I mean, how do we go with the genetic screening? Like, I mean, what is an appropriate age for that?
Right. So see, for those people where we do not know whether it was because of hereditary cancer, for example, colon cancer also can be hereditary. There is some gene called as HNPCC gene mutation.
Yeah.
Right? If that is positive, then the risk in the family is much higher. So for colon cancer, the general recommendation is even for breast cancer also. Do the screening 10 years earlier when the parent had a cancer. For example, here 40 years was the cancer, right?
Yeah.
So start screening at the age of 30.
Okay. The
For
children,
children.
once they reach 30, the test is like, okay,
Yes.
okay, I got it.
That's where
Thank you.
screening has to start. Even for breast cancer.
Okay, okay.
Doctor, because cervical cancer, you said it's between 9 and 14 years they have to take the vaccine.
Right.
Beyond that, they cannot take it.
They can take. See, there is no. This is all the Western guidelines. In Indian context, we don't have the ideal.
Visit after 14, they are 20 or 30. Can they
See,
take it?
ideally, it has to be taken before you are infected. As simple as for any vaccine, you take before you are infected. If you have a COVID already, the vaccine is not needed. Similarly, before your exposure, so before you are married or before the sexual exposure, that's when it has to be
So
taken.
once they are married and they need not take it.
Then we can do the HPV testing. So there is a HPV test available. So that will tell whether you are already positive or not. If you are negative, then you can take it. So the HPV testing is available. HPV DNA testing is available. Yes, please.
Is there any deformity in the person's structure and personality? The symptom, anybody can say that maybe it is a cancerous symptom.
Okay, in terms of the appearance, you want to say?
Deformity in the appearance or.
See, usually early stages, you will not even know yourself that you have a cancer. That's the problem with this disease. That initially you will not know at all. Later, probably once you totally lost your weight, you yourself will know. People will say you lost so much of weight, you are looking very weak. I think that is somewhere that where the disease is disseminated to the entire bones and the whole body. I think we do not want to see that at all. Yes, sir.
Yes, okay. The case for where the father died at 20, is it the age or is it the time when it was located? 10 years earlier, the children should be go for screening. So suppose the father had located cancer at 39 and died at 20, should not the children go at 25?
Diagnosis, not diagnosis.
Yes, diagnosis.
Diagnosis. Diagnosis.
Why is there any research going on for vaccinations of the cancer?
In general,
Yeah.
a lot of research is happening. If there is one field in which medical field maximum research is happening is in the field of oncology. Maximum newer drugs. Today we talked about lung cancer patient with stage 4 living for more than 5-6 years without any major side effects. Just 5-10 years back, lung cancer stage 4 we started 3 to 6 months. Now today I have many patients with lung cancer stage 4 who are just oral tablets without major side effects, living for more than 6 years, 7 years, and they are doing well. So that's what the research is happening in a big way, and we are looking at gene therapy also for cancer. So that will be much more meaningful. There's something called CAR T cell therapy for the blood cancer. So the most latest research is for that CAR T cell thing, wherein you are training your own white blood cells to fight the cancer. You take your cells, train them, and give back. So they are natural vaccines actually. So that is the big news that's happening in the field of oncology of the CAR T cell therapy. So that will soon be already the trials have shown very positive outcomes. So within next 3-4 years, I think it will be available in India as well.
Doctor, I heard something about the organ chemotherapy. I don't exactly remember the technical word for it. I think the research is happening somewhere in Germany. One of our family friends is undergoing chemotherapy now.
Okay.
I think the next stage is, some kind of therapy which uses this typical herbal kind of a thing, or I don't know what exactly that is, which doesn't harm the other cells. Whether it works only on the cancer cells.
Whether it is there.
Like how genuine and authentic
No,
that
I'm not really sure about that, but at this point,
it is there.
no, at this point of time, we still have something called as targeted therapy. So the targeted therapy is basically it's not going to affect other cells in the body. See, right? Traditional routine chemotherapy is acting everywhere in the body. Why do we have a hair loss of chemotherapy? All fast dividing cells in the body will be killed by the chemotherapy. Even if they're attacking the cancer cells, they'll also attack the normal cells. Right? So, but now we have a targeted therapy which are very specifically acting only on that particular target. That's what I was talking about the lung cancer treatment. Personalized targeted therapy based on the mutation present in there. See, today we are talking about only biopsy report. Now, already we have started treating based upon the mutation now. Not just a biopsy now. Send this tissue for genetic testing, see which mutation is there and which is targetable. So a targetable drug is available for a specific mutation. So not every lung cancer patient in the same stage will get the same drug. Depending upon their mutation, what exactly the genetic change that they had, a specific drug is available. So for lung cancer, we have more than 50 oral tablets available today in the last 5 years. So that's the kind of research happening. So that way, much more personalized care is available. Still, 70 to 80% of the chemo what we are giving today will be done away in the next 5 years, wherein it will be much more personalized. So we will test them. I think going forward it will be about something called as NGS, next generation sequencing, the genetic testing for all the the cancers, and then a personalized drug is given to them. So not all breast cancers will get the same. Today for early breast cancer, even if the risk is high, we give the same drugs for all the people. So I think that is slowly going away and become more personalized.
Already it is there in US, they are doing it like the sequence.
No, sequence is going on, but again, right now, for all diseases, it is not there. For example, ovarian cancer, you don't do it sequencing and then give chemotherapy. So to be frank, today the best practices, what is happening in the US, more or less available here as well. But what is not available here is the latest research that's happening in terms of the molecules which are phase 2, phase 3 trials. They are available there because it is all funded and supported there, and somehow it doesn't happen here.
My son also works with Thermo Fisher Scientific, where they are doing this sequencing.
Oh, excellent. Yeah, they have a very good NGS machines.
Doctor, do you recommend any tests in the school as a part of social responsibility? When you see your
in the
figures are so alarming.
Correct. No,
In the school we do many tests as part of our responsibility.
No, I think more than any test, I think catch it early and create awareness, educate them, cause them to think on this, make them go for HPV vaccination, incentivize them for taking proactive step. I think these are some of the things, I think the best way to reach out to people is through schools and colleges and, create this awareness in a big way. Because see, children usually, it's not something that you can do screening for children for cancer, because it's not very common disease. But children can be great ambassadors for the cause. Create awareness.
Good. Thank you.
Thank you.
Sir, with due respect to whatever you have just explained through these slides, my question is a very basic one, sir. Like, why does cancer happen in the first place? You have mentioned several cases where, the reason for the cancers are like alcohol or too much of tobacco use, or maybe lifestyle changes, or maybe not exercising, obesity, all these causes. But why does it have in the first place? I have seen in people who do not smoke, who do not take alcohol, still they are detected with this cancer. And children who are really, apart from the hereditary cause, what could be the other reason where we can, stop this? Because if we attack that thing, then possibly we will attack the why it is happening in the first place.
No, I think it's a very pertinent question. Definitely, cancer is a complex disease. It is not because of one factor, multifactorial thing. It is not, not just because somebody did smoke, it is not that, you would never get it. Okay, but if you look at how many people who have smoked have got lung cancer, 90% of them.
Yeah, that is
So 10% of non-smokers can get. In them, they had a predisposition in their body. Their genetic signature says that if so and so external factors are present, their cells will start dividing without control. So there is a signature in them. So based upon already there is a signature in their body, and the external risk factors like smoking or alcohol or pesticides, whatever you may call, stress is also a carcinogen, right? So all of this at some point of time stimulates a catalyst for this to happen. So in that way, we cannot absolutely say when it is beginning. We cannot. We have not got to that level. Probably in the future we may go to level where right now we are doing circulating tumor cells, right, where nothing is seen but cells in the body. That can be detected even with this NGS technology. So that will soon, where you give a blood sample and the whole body can be screened whether you have a cancer or not. So that kind of a screen test will be a reality very soon. But at this stage, why it happens, where we can intervene? No, the only thing we can intervene is either to change your lifestyle, adopt, or the other way is to diagnose it very early. So we are still at a later phase. What we said is even before it starts, why should we stop? Can we stop it? We don't have answer for it at this stage.
Thank you.
Yeah, that is a very question of academic interest. I think there was some findings or some research, as you say, the lifestyle, food intake and the food preparation. There is a possibility of accumulation of the carcinogens, which ultimately are the cause for the cancer. In Indian food preparation, mostly we use not necessarily oil, but there is a continuous use of aluminum vessels for the food cooking.
Right.
There was some research finding that the continuous usage of aluminum vessels, traces are being accumulated which are not discovered or easily identifiable, but over a period of time, does it have any significant role apart from other diseases? Does it have any significant role of accumulated continuous use of aluminum vessels for the source of carcinogenic cells? Have you got any relevant finding about it? I just wanted to.
Sure. No, I think that is very important because some rare minerals are protective. For example, manganese, that is very protective for cancer. Similarly, some minerals which are excess like aluminum, right? So various studies have proven. In fact, one thing is that there is no absolute study to say what is the quantity because our data is so imperfect. But one thing I can tell you is there is nothing like a poison. It all depends on dose. For some things, at a smaller dose, they are poison. For some, on a larger dose, they are poison. So at this point of time, I would rather say there is no robust, clear-cut answer to that. For example, let's say South Indians who take more sambar. We do not know the cause, but it is protective for colon cancer. Okay. So there is some ingredient in sambar. It could be. But again, we can't definitely prove. So we can't prove certain things. For example, cell phones causing cancer, or the cell towers causing cancer. Such a highly debatable, issue. But again, for last 30 years, we have not been able to really prove or relate directly to that. There were some cases where people said, my cell tower is close to my house, that's why I got a brain tumor, or I had a blood cancer. These are all some kind of correlation that you have made. But if you look at the overall evidence and the data available, I think by now, cancer should have been 3 or 4 times more because of only the cell phone usage cell towers. Because it's so much so, suddenly we have all upgraded in the last 20 years. Everybody has got 1 or 2 mobiles these days. So in that sense, overall, I think we can't categorically say one thing is only causing it.
It's a vast subject.
Yeah.
So, any more questions?
Yes, sir.
సార్ జనరల్గా ఈ వాట్సాప్ మెసేజెస్లో ఒకటి ఎక్కువ రన్ అవుతా ఉంది సార్.
విటమిన్ B17
కాదండి, అంటే క్యాన్సర్ అనేది ఒక రోగం కాదు, ఇది ఒక విటమిన్ లోపం అన్నట్టుగా అనేది అది దాని గురించి అన్నా.
If that is true, I will be most happiest because I will put my robot to rest. Vitamin B17 లేదు, దానివల్ల ఇది it's all industry driven. See, because there's always a double use. There could be something wrong with the industry also. I'm not saying industry is very fair. The pharma also has its own cup of things. Sometimes they push beyond, to just fit in their interests also. I'm not trying to support them. We know there is, see, COVID has shown us how clinical research works. In the initial days, wave one, all the publications were all bogus, right? So that way we know that it is not that, but still at the same time scientific evidence is something that we have to base our decision making. We can't just go with a kind of a subjective decision making. In the family, one member is cancer now, near far relative. In the good old days, in the village, if somebody had cancer, it was a taboo. They never even used to utter the word cancer actually. So that was the kind of situation it was. So in that sense, it's just because one line I can tell is because of lifestyle. Definitely.
Okay. Yeah. Any more questions? Because it's a very vast subject, we can keep on, asking. And our special invite. One more question, just last chance.
Last question.
Can you medical test to find out prostate cancer? At what age?
Prostate cancer, yes, for men age more than 50 years, do an annual PSA, prostate specific antigen. Okay, simple blood test which can be done, and a digital rectal examination by doctor once every 3 years is good enough, and that can diagnose very early the prostate cancer. One good news about prostate cancer is it is one of the most curable cancers. If a young person is asked which cancer you want to have, you should say thyroid cancer because the results are extremely good. Similarly, after 50, after 60, there's one cancer that can usually not really kill you and give you good outcomes is prostate cancer. So these two are extremely good in terms of outcomes, but again, stage is important. Even in prostate, with stage 4, we have people living for more than 10 years. So in that sense, early detection is important. I'm not saying that you can ignore it, but even if somebody has this, need not worry. It can be potentially cured.
Sir, one question.
Yes, sir.
క్యాన్సర్ వచ్చిన తర్వాత థర్డ్ స్టేజ్ వరకు వచ్చి ఎవరన్నా తగ్గినది కంప్లీట్ క్యూర్ అయింది అని అంటే మీరు ఆల్రెడీ ఎవరన్నా ఉన్నారా?
కొన్ని వేల మంది, లక్షల మంది ఉన్నారు. లక్షలాది మంది ఉన్నారు. See, that is a big, people think that it is not curable, it is just gone, it's only time waste, ఏదో చేస్తున్నారు, మొదలిస్తున్నారు. No way. I have seen even stage 4 cancers cured in many cases. Stage 4.
Thank you for your excellent interactive session. That is what is meant for. Thank you, Doctor. Really, it's a wonderful session. Because the level of enthusiasm you have, rather than giving information, you have more passion to interact with the people. That's where we enjoy it. Such kind of interactive sessions only we would like to have it. So, yeah, we request Dr. Pramila to please come and occupy the seat in the front row.
Dignitaries on the dais and off the dais, esteemed members of District320C, invited guests and my dear friends. I would first like to thank the presiding officer, Lion Singhi Garu, for bringing in and creating a great opportunity for this awareness talk. I would first like to thank Dr. Chinnababu Sunkavali Garu for taking your time and accepting the invitation to give a distinguished talk today. We are so honored, sir. I think more than thanking anybody else in my vote of thanks, there are 3 categories under which I would definitely like to thank you, sir. I think being a mental health professional, I always felt that you need to seek certain opportunities to see how you can feel happy and how you can have a positive attitude, mindset around. And I think the very idea, the way you were trying to put forth a very serious topic into a very lighter thing and trying to give us a simple aspect of a very complex aspect is something that's actually touched us today. Thank you so much for that. And the second area I would like to touch touch upon where I would definitely like to thank you is being a spiritual person. I believe clapping is something that's pretty important because it activates the whole energy chakras as our belief system. And I think when we are hearing your profile and the way you're working, I think we almost clapped around 7 times. I was keeping a count of it. And I think 7 times you've activated the chakras of all the people here. And I think which is an amazing job, which we don't usually do. So I would like to thank you again for that. And the third issue I would like to thank you about is the whole objective and ideology of what we are doing today. I think the awareness. This is something that's so important. I think as you just mentioned, like it's mostly considered as a taboo and we really don't want to talk about it. Like if something happens in the closest family or in the neighborhood, like we really don't really bother to talk about it, but thinking that we don't want to rebring the memories of the trauma the family has undergone. But I think you made it quite easy for us, to talk about it, to openly talk about it, and I definitely like to thank you for that. And I thank all our Lions members and dignitary leaders, like who have made it possible today to hold this special session, and I really think it makes a lot of difference. And I also thank all the people who are here, the leaders who are here, because it is just not this little number what we are seeing, but I think it is the number that is going to go to the society, that is going to go to the community to talk about it. So I think we are just not representing these few chairs that are here, we are representing the whole community of Hyderabad. So thank you so much for everything, sir. And I thank once again for this great opportunity. Thank you so much.